Welcome back to The Wellness Effect. In this episode, Dr. Jedd Myers joins me to help us discover and understand the benefits of tracking your wellness. Welcome, Doc.
Thank you so much. Thanks for having me.
It's an absolute pleasure. Really looking forward to having this discussion. Why should employers encourage their employees to kind of track their wellness journey?
I think it's important to understand that this journey is a two-sided journey, not only from the employee perspective, but from the employer's opportunity as well. Because to many employers and organizations, the investments in these programs are often seen as grudge.
Yeah.
It's often a little black box, a tick box related to either compliance or other type of industry best practice. And really they're missing the real opportunity, understanding the value, impact, and the outcomes that can take place by employees understanding and tracking their wellness, and the organization doing the same as well. I think the old adage that you can't improve what you don't measure really holds true. And for most people, this is not only waiting for a negative outcome from a mental health perspective, from a physical health perspective, but really understanding that people need to know where they are on their health curve, their health trajectory, because it's inevitable that everybody is going to go through some level of decline, be it physical, mental, emotional, cognitively, spiritually, as they age. And if you don't track your health and your wellness, you're never going to know where on this curve you are. And if the goal is to optimize performance,
Yes,
and at the same time minimize risk, really extending this new notion called health span. It's not only solving for time and lifespan, but solving for quality of life, performance, optimization, this notion called health span. One really needs to be able to understand where they are on this journey, track it effectively, know how to leverage the data, use the data, and create the best outcomes for them and their organization as a whole. And if organizations can promote that awareness, that consciousness in their employee base, be it executive, blue-collar workers, white-collar workers, across the board, the ability to empower oneself with understanding their health, understanding that this is a platform, this is an opportunity to improve performance, to become a better person, a better spouse, a better partner, a better contributor to your organization, to society, then the results of that organization are going to start to improve. We've tracked this scientifically for a long time, and it holds quite true. And really such an effective way to bolster performance and culture in an organization, leveraging health as that platform.
that's amazing. And in your experience, have you seen that as organizations support their employees in tracking their wellness, there's been an increase in productivity?
Absolutely. I think it's not only about supporting them in tracking their wellness, it's about dispelling any stigma, any myths around health and wellness in the organization, be it around mental health, which is still highly stigmatized, HIV, chronic diseases, obesity and body image. These are highly stigmatized subjects. And if employers can break that stigma, break the myths around it, encourage people to take up any opportunities, any programs that are run in the organization, empower them to track their health and wellness, give them the tools to leverage that data into something effective and tangible for them as contributors, then not only are those employees more prone to be better contributors to the organization, they become better people, better human beings.
That's right.
And definitely the productivity of the organization is going to improve. You suffer, there are a few metrics that we track in organizations like this. And some of the direct ones are things called absenteeism and presenteeism.
Correct.
And presenteeism is when people are at work but are just ineffective. And if you're suffering from mental distress, emotional distress, chronic diseases of lifestyle, any physical ailments, you really are not able to give your all at work. You're not able to give your all at home. And that is a vicious cycle of a downward spiral that ultimately impedes your performance, your ability to be productive. With better health, with better mental clarity, with better opportunity and platforms for performance, you perform better.
It's true.
As an individual, as a contributor, and as an organization as a whole.
How can employers be more proactive in assisting their staff when it comes to their medical needs?
I think to answer that question effectively, you need to just break it up a little bit into its pieces and really understand this notion of proactive. What does it mean to be proactive? Because many of the solutions that we find in the corporate setting from a healthcare perspective are by nature and default reactive.
Mm.
It's one thing to be compliant, if you can be as an organization, with the legislation. We often deal with this in our clients in terms of safety and hygiene services. It's another thing also to be compliant from a risk perspective and ensure the risk effectively in an organization. But to be truly proactive,
Yeah.
one needs to move away from just ticking the boxes.
Yes.
And aligning with what is seen to be legacy products, seen to be industry best practice. And to really understand your workforce's health, one needs to be able and willing to take the first steps in gauging it, interpreting the data, and then building the bespoke programs that are effective for that client set. We pride ourselves in that setting because most solutions are by nature, as I mentioned, on reactive. For someone to pick up the phone and engage a counselor for mental distress, or for someone to suffer the complications of a chronic disease of lifestyle, like a heart attack or stroke, these are long building complications. They take years, if not decades, to build and to manifest. And rather what you want to do is engage people early on in their health journey, as early as possible, empower them to understand what it means to track their health, to leverage that data, to make the right decisions, to empower them to be better people and perform at a high level. And I think employers have this responsibility, have this opportunity to really, really take this and grasp it firmly, to engage their staff base early on in their health journey, to empower them to understand the benefits that they have, to integrate across the board. We really believe that this integration is one of the key opportunities to drive value into the corporate. It's not about competition. It's about collaborating and working together. All the different pieces of the employee's health journey that the corporate might be funding, subsidizing, can really be integrated quite nicely together to leverage that. That might take the role of mental health programs, on-site clinics, on-site programs, executive health programs. But the nature of the program is less important than the culture and the strategy of the organization, which should be to leverage health as a platform for performance, not only see it as a risk mitigation tool, and not be comfortable with the ignorance of not knowing the health status of the employees of one's organization, because this is really a situation where ignorance is not bliss. These diseases take a long time to manifest. To ignore them and not truly engage proactively is really, really playing with fire. Because once these complications start arising, once the mental health complications arise, the physical health complications arise, they're devastating to the individuals, to their social circle, to the organization as a whole. And one of the messages that come out of that is that individuals and their health cannot be seen in silos. An individual is a holistic person. And any truly proactive program is going to take all those factors into consideration. Physical health, mental health, emotional health, spiritual health. Truly, truly encapsulating the full biopsychosocial model of healthcare of that individual, that society or that structure and that organization.
I loved you mentioned this point, health as a platform for performance.
Yeah.
So let's talk about, how do you kind of measure your wellness journey? What sort of apps, devices, journals can one use?
So I think the ability, we live in a time where the ability to track health data is almost ubiquitous. For a couple $100, you can pick up a wearable in a store and track your heart rate, see how you're sleeping effectively. You can measure weight and other body measurements quite easily. I think the better question to ask is what to do with that data. How to empower individuals that are recording the data to use the data. What does the data mean? So there's a very big angle of content, education and empowerment of individuals, and then really, really gearing them and guiding them in the right tools, because we do live in a world of the shiny coin, where every different day there's a very shiny app or device to track and integrate in health. And it ultimately comes back to a few very big levers: exercise, nutrition, sleep, mindfulness, nutrition, supplementation. And if we can just give the right content to support people, employees, who are already tracking their health in a number of different applications, be it through a funder like Bankmed or any other type of organization where they're tracking their health, and really rather focus on empowering individuals to use that data, understand what it means, what the numbers mean. It's such a powerful thing that these metrics can come down to a number. You can take cholesterol, you can take blood pressure, bring it down into a number. and with the right layer of content can empower people to know what that means, what they can do about it, how they can improve it over time. Because this is a lifelong, indefinite journey. This isn't a quick fix for no one. And as I mentioned earlier on, it's inevitable that your health is going to decline.
Yes.
So if you can find yourself on any part of this journey, wherever you might be, and understand what that means, to then make the changes to improve that over time, then you've been truly empowered as an individual, as an employee, and a contributor to this broader organization.
So, Doc, maybe briefly, everyone has a Batman or Superman origin story. What's your origin story in short, and what exactly does your group of companies do?
So I always wanted to study medicine. I wanted to emulate my grandfather was my role model. And going through medical school and towards the end of it, I realized that my passion actually lay in building systems to deliver healthcare and impact through health on scale, as opposed to delivering treatment one-on-one. And I took that initial drive and that initial pull and really built business plans and business models to activate that strategy, to activate that strategy and to positively affect the health and lives of thousands, hundreds of thousands, millions of people. So I look back very validated that with brilliant business partners and brilliant people in our businesses, we've been able to achieve that locally and abroad. Our group of companies, as it stands at the moment, focuses on executive health and wellness through a brand called ExecCare, where we test, assess, and manage the health of executives of different clients. Occupational health and safety and primary healthcare under a brand called OccuFit, where we run on-site clinics and a range of different compliance-based solutions to make sure that organizations and workforces are compliant and effective in terms of the healthcare that they provide from a physical perspective on site. Mental health. We're firm believers that mental health is not something that can be delivered in isolation to physical health, and that mental health is a safety risk in an industrial and general workplace setting. So we've built a truly proactive mental health program. We brought some experience we built internationally, building that service internationally into South Africa. We run quite a large health eventing business, which does HIV testing and wellness day work in the context of activation of programs and initial testing of biometrics in order to gauge how people can be managed. And we often do that management of those individuals, mental health, chronic disease of lifestyle, HIV. And that whole group is branded under a big brand called Health Impact, because we've always worked back from creating impact through the health in employees of organizations.
Amazing. I'm very shortly interested in ExecCare. What are you seeing? You mentioned in our discussions, what are you seeing in relation to the healthcare of our execs in South Africa?
The statistics we see are concerning. The executives that come through the center, the experience that's been built in the center is one where executives feel very comfortable and at home. It's not the setting of a clinical setting. It's more the setting of a first-class lounge with a clinical backbone. So there's a lot of barriers that are put down, and executives feel very comfortable, very vulnerable when they come through the experience. And the health stats we're seeing is, I always say to people think we've come out of a pandemic, but we've just gone back to the old pandemic we're in, and it's much worse than it was before. And that's a pandemic of poor mental health and poor physical health. We see a significant burden of mental health, the inability to cope with stress, a range of different early and complex psychiatric and neurological diseases. On the physical health perspective, significant metabolic illness and rooted in poor metabolic health. And that manifests with high blood pressure, poor cholesterol, obesity, liver dysfunction, insulin resistance, and a range of different manifestations. And how that manifests for these executives on a day-to-day basis is that they're going into the ring with their hands tied behind their back because they've got the mental fortitude, the mental skills to be able to apply their knowledge in a very complex way. These are very highly functioning people, but they're also human beings. And you know, that executive population, it's almost a badge of honor. The less you sleep, the harder you work, the more you drink, the more stressed you are. It's almost that you're excelling. Whereas actually they're compromised. They don't have this platform of performance. Their health is not leveraging them into a space of optimal performance. It's holding them back. And the message we really try to create is that there are two sides to this coin. The one side is risk. Clearly, we need to mitigate the risk. But the better opportunity, the more exciting platform, is that we can create a platform for better health, longevity, performance, not only in their settings as executives, but as parents, as partners, as children, as contributors outside of work. Many of these executives contribute to philanthropic causes, are involved in community causes, school causes. So to be a better and more effective person in their workspace and in their personal and social life is quite an empowering epiphany. And if there's one thing we want executives to leave with, we say it's the wellness epiphany. That moment when they really understand that they can take control of their health and live a more optimal life.
Thank you, Dr. Myers, for such an engaging conversation and for the incredible work that you're doing at Health Impact.
Thanks for having me on the show.
Absolute pleasure. And thank you, our viewers, for joining us again. Remember, all our previous and upcoming episodes of The Wellness Effect are available right here. So subscribe and hit that notification bell so you don't miss out. See you next time. Bankmed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by Bankmed, yours in good health.